Finally Friday.
The end of the week. We have been talking nonstop about the coronavirus on our show. Everybody's talking about it nationally. So we thought we'd bring in a doctor. Dr. Jeffrey Galvin is in with us.
I was going to say, it's not Ben.
I know.
Yeah,
this is not Ben, and that's not Larry.
Ben has the morning off, at least this part of the morning.
Yes.
Yeah.
So
but, you're board certified in emergency and obesity medicine. You're a practicing physician in the emergency department. So thank you for joining us.
Well, my pleasure.
We've been asking people to text us if you've seen on our show, and you still can, or you can just leave a comment at this point now that we're starting our Facebook Live, and you're going to answer some questions people have.
Yeah.
And the thing that's so interesting about all this is being someone who works in an emergency room, you're getting the latest up-to-date information whenever it comes out.
Yeah, we are actually getting updates several times a day. And so there's a torrent of information. We don't know a lot, unfortunately.
It's such a mysterious illness to the average person, and when the medical profession, because it's so new, you guys are still learning, minute by minute about this.
Exactly, and it's changing from day to day. We're learning more and more, and so we've just got to do our best to take preventive measures and do everything we can to avoid getting it, and more importantly, avoid giving it to everybody else.
Yeah.
It's a virus.
It is a virus.
It's not bacteria-induced.
Right. So
virally induced.
Virally induced means that there's no antibiotics, there's no treatment for it.
Right.
The majority of people are just going to get basically cough and fever and are going to go through just like a flu. It's going to last for a number of days and you're going to get better.
So why is this freaking people out?
Well, I think...
Because we have things like the flu that have huge numbers.
It's a mysterious thing. I mean, it's like, oh gosh.
Well, for one thing, we're naive to this virus. So flu we get exposed to all the time. This is a brand new virus, so none of us have any intrinsic immunity to it.
To fight it.
So if you get exposed, you're likely going to get it. And also, it's got a fairly high mortality rate. The latest numbers I saw was about 3.4%. Flu is about 1%. So there's a higher chance of getting seriously sick. And people die of the flu every day in this flu season in North Carolina. And so this is at a higher risk. And one of the questions we see here is like underlying health issues. What does that mean? Well, if you're elderly, if you've got diabetes, if you're immunocompromised, if you're getting chemotherapy, you're on chronic steroids, you have some sort of chronic illness, your ability to fight this off is lessened. And since we don't really have any treatments other than supportive things, it can be potentially very dangerous.
What are some of those supportive things? I mean, if you had coronavirus now, what would you do if you were a physician? What would you prescribe?
And I'm assuming I'm going to get it as an emergency physician. So what I'm going to do, I'm going to do what my grandmother told me. I'm going to eat chicken soup. I'm going to take Tylenol and Motrin for my fever. I'm going to get as much rest as I can.
And quarantine yourself.
And I'm going to quarantine myself.
What does that mean?
So that's a great question. What does quarantine mean? Well, I may well get exposed and have no symptoms. So if Carolyn comes in and she's got it and I get exposed, they're going to say you're quarantined for 2 weeks. I'm going to feel fine. What does that mean? It means that I have to be alone in a room, locked away in my house, probably wearing a mask, because I can give it to all of you guys. And I may not show any symptoms. And that's one of the other concerns, is that you can potentially transmit the virus without exhibiting symptoms.
Let's get to the questions.
Well, I was going to say just one quick thing. That's voluntary. I mean, it's not by law you're quarantined. Is that right?
Right. And
so you quarantine
there's been some cases
yourself
already where people have ignored quarantine and exposed others. I think we have an intrinsic duty to society to take this seriously. But if you are told that you're quarantined, it doesn't mean you've got the day off of work and go out to the gym and go shopping. You really have got to take this seriously, because suppose you expose an elderly person and they die. I mean, that's preventable, and that's what we're trying to do.
Right. Okay. So first, we're going to show the questions that people have been texting in over the last 2 days. Here's the first one. You kind of touched on it, so we might be able to skip to the next. But you said, "Good morning. My question would be: the virus seems to affect elderly people with underlying health issues. What's a better explanation of somebody that would have an underlying health issue?"
Well, I think he already did discuss this, right?
Yeah. I think that extremes of age are typically what we worry about. So if you have chronic medical problems, diabetes is an intrinsically immunocompromising disease. If you've got a history of cancer, you're under chemotherapy. If you've got bad heart disease, if you've got autoimmune disease, anything that wears the body down and lowers your ability to fight infection, so an acute infection, may make it worse if you've got an underlying pneumonia. And I think one of the problems that we see is that people develop COVID and then they develop these subsequent infections and it gets sicker.
Yeah. All right. The next one, I think this is great, and I think this is on so many people's minds. My 5-year-old is not the best hand washer. How do I explain to him the importance of washing his hands without scaring him? Because you want to make sure that, you should be washing your hands well any time. But a 5-year-old, it is hard to explain.
Right. And having had several 5-year-olds, they're hard to get to do
what
anything.
would you do if they were that young?
So I think that the best thing to do is to maybe explain to them that, hey, there's these things around, they can get on your hands, and if we don't get them off our hands, it can cause problems. So the water sprays that stuff off, and we rub it away with the soap, and it goes away. I think we got to make it sort of fun, not scary. Again, getting 5-year-olds to, the other thing is touching your face. We're trying to tell people, don't touch your face. Somebody described it as like, pretend you just cut up a bunch of hot peppers and you got to change your contact lenses. Like, treat your hands like that.
It's hard not to do that.
It's hard not to do that.
You don't realize how much you touch your face until you start thinking about it. You're like, whoa.
Just watching last night, even some of the folks giving the message, there was one, I can't remember the lady's name.
I saw that. And she's in the middle of the...
Right in the middle of it,
It's so hard because it's not something that we think about.
So maybe create a 20-second song
I was just
about
gonna
bugs
say,
on your
right.
hands,
Right.
washing the
Yeah, something.
I think you try to make it fun. You
Right.
certainly don't want to tell your kids there's these dangerous things on your hands, but I think one of the things I remember teaching our kids, like, that the water splashes it off, you got
get it off.
Get it off.
Right.
This is really interesting, this next question.
This to me is super interesting.
And we also just heard somebody asked about produce too, so similar.
So can the virus be
through
transferred
handling things,
through money? People are concerned about money, about mail.
Right. So the coronavirus is relatively heavy. So if I've got it, I cough, it's going to go out a couple feet and then it's going to settle to the ground. It's going to settle on surfaces. And if I touch those surfaces and then I touch my face or a mucous membrane, I can get exposed. So money's a great question. We don't know how long it lives. So some viruses only live a few minutes. Some can live for extended periods of time.
But because this is so new, you don't know.
We don't know. Now, we do know that China and Korea are starting to sterilize their money. So
how are they doing that?
They're exposing it to UV radiation, then they're putting it in a bag for 14 days.
Wow.
Yeah.
Wow.
So if you have an option of paying by cash or by credit, maybe credit.
Use your own card
the
and keep
thing is,
cleaning it.
so many people don't use money today, but it's other things that you may touch. I mean, it
Mail.
could be anything.
Yeah.
Mail, it could be like in a store, picking
Yeah, and I
an
think
item up.
if you look at the CDC guidelines about washing your hands for 20 seconds, but you go to the bathroom, you wash your hands, you're at a public restroom,
You touch the
and then you
doorknob.
go to walk out the door. What do? You grab the doorknob and everybody outside. So grab a tissue. Open
Before,
that door.
yeah.
Open that door with your elbow. Everything you can do to.
I never really opened the door at a public place. I always get my
exactly.
shirt or whatever.
But if you do it with your shirt, then it could be
Well, it's
on
on
your
your shirt, yeah.
right? So it's
It's the
better
way
to
to
grab
escape
a paper towel or something.
Yeah.
So the other thing I wonder about are those the bathrooms that don't have paper towels.
Oh, the air thing.
Guess
Yes.
what they're doing?
Recycling the air.
They're blowing them.
The virus that's on the ground
you're
up
right.
everywhere.
Right. So I wouldn't use a hand. I would not
So
use
once
one of
again,
those.
we
Okay, so
know,
don't use the things that blow, the air.
We don't know how long this virus lives. So I mean, there's so much that we need to learn about it. The medical community,
And it's
professionals,
so
everybody.
new.
Yeah, it's so new.
It's called a novel coronavirus, right?
That's where that comes. That's where that novel comes from.
Right.
It's brand new.
Nobody's ever seen it before.
Okay.
Yeah.
Speaking of new, we want to get to all of these questions in our amount of time. They're saying, am I protected from the rest of the season if
they
I catch
catch
it
it.
now? So,
I
flu.
feel like I'm doing this over and over. Great question. We don't know.
Right.
We think, that you'll develop immunity, but we haven't had enough people that have it and gotten better. So there has not been a lot of case reports of people getting it multiple times.
But it's still new, so you don't know, right?
And we also know that there have been some case reports of people shedding the virus even after they've gotten better from it. So you may still be contagious for a period of time after you're all better.
Oh. Is there a season for it? Is that a question that we have? Because that was my question. Is we have flu season, and then really after May, you kind of there's not a big risk.
That was a question.
Yeah. So some of the
Sorry about that.
No,
some of the commentary I've been reading from the scientific circles is that this may turn into another seasonal thing. So we have a flu season.
Right.
We may end up having a coronavirus season, and every year you get your flu shot, you get your corona shot. Right now, there's no vaccine for corona. There's a number of companies that have developed potential vaccines, but they need to be tested. Probably, we're talking minimum, if we break all the rules, maybe a year.
What is the risk of, obviously they have to weigh the risk, right? Is there a bigger risk for not breaking the rules and waiting longer? Or is there the bigger risk of breaking the rules because there are all these protocols and safety things in place?
Right. Well, you've got to do human trials, right?
Yeah.
So, you don't want to just roll out a vaccine that we don't know works. And, how do you know it works? Well, you got to give it, and then you got to wait and see.
And I think it's better if it's ineffective rather than it could cause side effects.
Or there could be side effects.
Right, I'm saying it's better if it would just be ineffective, but the side effects could be something serious.
We've gotten some great questions too on our Facebook Live, so I'll ask a couple of these so we're not leaving you guys out. But how is this different from pneumonia or a different respiratory virus?
Right. So a lot of these respiratory viruses are similar. A pneumonia is typically an infection in the lung. Now, we typically think about bacteria. So when you have a viral illness, like for example, when we take care of these really sick flu patients, these elderly folks that end up dying, they usually get the flu and then they get a secondary bacterial pneumonia, and that combination is very dangerous. COVID, actually causes a viral pneumonia, so you can get actual inflammation in the lungs from the virus itself. And so one of the screening things is to do a chest CT, and there's a characteristic pattern on chest CT. So we think it can cause a primary pneumonia. We don't know if the people who are dying of the actual viral pneumonia or if it's a viral pneumonia with a superimposed bacterial component.
There's so many parts of this. I mean, it's just magnifying.
And we just don't know. I mean, it's so early.
Do you have the test kits at the hospital now?
That's a great question, Carolyn.
And can you not answer it? I probably should have asked you.
Explain a test kit, what that is.
So, right now, the CDC had a test that was inaccurate, and so they had to recall it. There's a lack of the reagents. They're trying to expand. I think LabCorp is coming out with a test soon. Right now, our protocol in our emergency department is if we have somebody that's been in an endemic area or been exposed, has fever and cough, then we're going to test them. And that test is going to get set off to the state, but it's going to take a couple days to come back.
What is the test? What do you do?
I think it's a nasal, it's either a nasal or oral swab.
Right.
The flu test, we do it, we get the results in in a minute. That we don't have tests like that for corona.
So for those 2 days or whatever that they're waiting for the test,
you're going to be quarantined. Yeah.
And speaking of getting tested, you don't want people running to the emergency room.
Yeah, so that's the other thing, and I think you're going to find that hospitals will start giving guidance. If you have fever and cough, don't go to your doctor's office. Don't go to the hospital, because what's going to happen is you're going to expose everybody else. And so the best thing to do if you're worried is probably call your doctor first. The majority of people are just going to have a respiratory, they're going to have some fever, they're going to have some cough, it's going to get better. As long as you're not having shortness of breath or really significant symptoms, if you come see me, I'm going to say, yeah, you should take some
now I'm out of work.
some cough medicine, but I'm not going to prescribe anything because there's no treatment.
nothing to prescribe.
And thank you very much for exposing everybody else that's here.
Including myself, now I can't treat people.
Exactly. So if I get quarantined for 2 weeks, that's 2 weeks I'm not seeing patients. I'm just sort of...
Yeah.
Here's an interesting question right here. I've read that COVID-19 has mutated. There presumably are 2 strains now. Most people have become infected with the more aggressive strain, but Chinese experts say they think the deadliest version has lost some power since January. Can you explain what that means?
I can't answer that because I have not, the CDC has not said anything about multiple strains. These viruses mutate.
Yeah.
So the flu mutates every year. That's why we have a different flu vaccine. When you get your flu shot, it's not the current flu, it's last year's flu.
and they're guessing at that point what they think.
So the idea is that last year's flu mutated, and if we immunize you against that one, you're going to probably be protected against the new one. Then every once in a while, we talked about H1N1, you get a flu that really the flu vaccine doesn't work very well for. Right. We don't have anything about this. We don't know. So I don't know about mutation rates and things like that. I'm not aware of a deadlier strain versus a less deadly strain. I think we got to treat everything the same until we have a lot more information.
What's really concerning to me is if the coronavirus does become a thing that we see yearly and they have the same season as the flu, but maybe you could catch both of it. I don't know. Right. I think it's just the possibility of...
And with the mortality rate, I think when the vaccine comes out, it's going to be really important that you get that vaccine.
Here's a question. Why isn't anyone mentioning vitamin C as a preventative? It's been proven to be antiviral. they're using it in China now. Is this true? I mean, and my question is, we're seeing so many people thinking certain things because they're hearing it.
Right.
And we don't know. I mean, we see something online, and if you're not an expert, you don't know if it's...
As you know, I always say to you, observation does not equal causation.
Right.
So just because, I saw 4 pink cars today and it's overcast does not mean that overcast skies cause me to see pink cars. Yeah. So we don't know. We do know that vitamin C has some antiviral properties. We also know that it's incredibly safe. Would it hurt you to take vitamin C? Absolutely not. Do we have a study that says, hey, we gave this group of people vitamin C and this people didn't and they did better? We don't have that. It's so early that none of those studies have really been.
So it can't hurt to take vitamin C?
It cannot hurt you to take. I would take it.
How much would you take, would you suggest?
I would probably take 1 to 2,000 milligrams.
Yeah. Okay.
1 or 2 of those big ones.
What do you say about travel? Not just like, a trip to abroad, but just a work meeting in Kansas, just as an example.
Because if you're going to be on an airplane,
community spread is a real concern. And what does that mean? Well, community spread means that I come on the show, I've got COVID, I don't realize it, I just gave it to you guys. Now you guys go home.
And we don't know.
And you expose your family and your friends and your anybody else that you come in. And so that's community spread. We're starting to see that with COVID. So the initial cases were all like, oh, this guy was in China, he was in Milan, he came back with these symptoms, he's got it from there. Well, now we're starting to see cases where you can't link it to a travel or something like that. And so that's going to be an issue of spreading amongst the community.
When you, let's say you did have it just come into contact. I mean, you're not coughing, you're not sneezing.
Right. And so if I'm washing my hands, you're washing my hands. If I don't cough directly in your face, you're probably going to be fine.
Okay.
But let's say I cough onto this table.
Yeah.
Or when you're talking, you spit,
So-
You touch your face.
I've heard people talk about social distancing, and that probably plays into factor with like the traveling and going different places, interacting with different people. What does that mean?
So, social distancing essentially means like if I stay this far away from you versus this far, like you're at lower risk of getting it from me than if I'm right next to you like this. The Olympics, we're going to bother these people. Are they going to cancel the Olympics?
Yeah.
I would be certainly thinking about that. Cruise ships, we talked about cruise ships. Why are we having all these outbreaks in cruise ships? Because people are crammed together.
So you would avoid cruise ships?
Well, think about all the public events people go to, concerts, and just having a lot of people in one room at one time. Airports.
I mean, so good personal hygiene, hand washing. Try to avoid crowds if you can. I mean, we don't want people to panic, but you've got to be smart.
I mean, but at the end of the day, we're not going to make this extinct.
No.
So.
But I think what we usually find with these things is once we learn, once we have knowledge, we feel more comfortable. We'll be able to develop a vaccine. We'll be able to manage it. HIV is a great example. When I was training, HIV was a death sentence. Now it's a chronic disease. It's like, you take your medicine, no big deal, right? But, at the time, it was, a earth-shattering thing. And we've learned how to manage it. We've learned a lot. So I think that we'll eventually get to the point where we treat this like the flu. And it could be that it comes, it burns out and never comes back. But I do think that once it's out in the wild, you're probably going to see some
mutation in different strains
and things like that.
So we have 30 seconds left. Dr. Galvin, I think the final thing that everyone wants to know is what should people be doing, regardless of whether you're healthy or you're not healthy. The average person, what do we need to know and what do we need to do to protect ourselves?
Wash your hands. Absolutely wash your hands. Avoid touching your face. If you've got facial hair, guys, it might be a time to shave the cool beard because it can hold that on. Be aware of your surroundings. Be aware of large gatherings of people. And if you're sick, stay home. If you have a fever, if you're coughing, do not go to work. Call your doctor. Don't go in. Call. Say, what should I do? Be cognizant of your impact on the community. Take care of yourself, take care of everybody else.
Great information.
Thank you enough for coming.
Dr. Galvin, thank you so much.
My pleasure.
Come back again, please.
Absolutely.
Bye, guys. Thanks.